as organizations, there's a tendency not to work together. Instead of complementing, we compete. But with collaboration, we achieve so many things in a short space of time.
The emergence of COVID meant that we follow the strict regulations that we issued for people to stay at home. There were no activities at all, but fortunately the funder at the time continued to fund to keep the organization afloat.
Everybody was anxious at the time, that there was no direct communication as to what is our standpoint as government, where do we want to fit in immediately. It took a little bit of time before we got our act together, and that actually meant some of the key services and key beneficiaries were badly impacted.
Our organizations played a huge role at grassroots level. Even though there are health facilities maybe in every location, they were the most unprepared at the time. They were not used to reach out to communities.
The importance of the civil society role within the community itself, there was knowledge being given to the community. They make sure that people understand and do have knowledge about this.
How many people here have worked for an NGO for 20 years? Who here had COVID?
Sure.
Were you nervous about the vaccine, the COVID-19 vaccine?
NACOSA helped because they took us for counseling. So it was through that counseling that I saw that I have a role to play, because there are more people who are scared more than me, who are less informed than me. So then I took on the challenge. My partnership with NACOSA opened doors for me for Department of Health, because I did not have that funding until I collaborated and partnered with them. Then they recognized me for my hard work and they funded me.
We're a small and upcoming organization. This funding, first of all, it launched us into a close proximity with the Department of Health so that they could understand the capacity that the CBOs like our organization have in working with government.
I think because we were now already beneficiaries of the NACOSA community strengthening programs, we had resources and adequate training also that could actually put us in place to implement the program with the Department of Health.
NACOSA gave us an opportunity to be relevant during the pandemic, and they trusted us enough that will make it different. So we used that opportunity to learn, to develop, and to be capacitated.
The integration of our programs, I think that was the most key way we are able now to think beyond whatever that we are doing. Let's not focus on generalized people, but also focus on the key vulnerable populations which were being left behind.
We didn't realize the power of collaboration, how much we can learn from each other, how much we can cross-capacitate each other.
Working with the Global Fund and NACOSA has been one of the best experiences of our lives as an organization, and we really appreciate the type of support that we receive.